An endoscopic facelift is basically a facelift that's done with smaller incisions so you have access to larger tissue areas. You have an endoscope, which is a lighted camera in one hand, and in your other hand you have a surgical instrument. Endoscopes have been used for facial surgery. I started using them around 1990, 1991. We first did brow surgery, then we did cheek and mid-face, and now we have advanced to doing even lower facelift surgery through incisions in the mouth, inside the mouth, so you don't have an external scar. So the endoscope has many advantages, especially in the beginning when you're learning all that anatomy, and then later to be able to do a facelift without having scars with someone that has a lot of experience with an endoscope is a huge advantage for people. An endoscopic facelift lasts approximately 10 to 15 years. For someone a little older, say 55 to 70, and it lasts 15 to 20 years if it's somebody on the younger end when they have it done, say 40 to 55. And the reason is the younger you have it done, the better it heals and the longer it lasts, because your tissues are in better shape. And the endoscopic approach allows you to have larger areas to reset and anchor the tissues through an incision that's hidden, as opposed to an open incision where you can't get to certain areas without there being a larger scar. So the trade-off for most surgeons is they do a smaller incision to try to prevent scarring, but it affects how long that facelift will last. So the endoscopic facelift will actually last longer in experienced hands. An endoscopic facelift is performed with a lighted telescope about the size of a large McDonald straw, and you have instruments in the other hand, and that's called an endoscopic camera setup. And it allows a surgeon to have smaller incisions and a larger view of the tissues. But what's very important is there's a steep learning curve, because you have to learn the anatomy from the inside out, so to speak, because you're inside the tissues and you're not seeing the tissues from the outside. So the endoscope allows a person that understands all that anatomy to do a lot of surgery that's very hidden. So that's the advantage of the endoscopic approach. Unfortunately, there's a learning curve, and so it takes years to be very proficient and efficient at performing endoscopic surgery. Please make sure to subscribe. The recovery from an endoscopic facelift is less time than a traditional facelift, because you're not disrupting a large vascular area and you're keeping the tissues intact. So if you go through a small incision with an endoscope and you're working on that tissue, but the skin is not disrupted, that's where the supply of blood comes from, the skin and the fatty layer, that does not get disrupted with an endoscopic approach. So I tell people that, the minimum to get back full steam ahead is about 2 weeks. And I prefer for people to take 3 weeks for endoscopic facelift recovery. When you think about having a facelift, you want to have a facelift that has natural results. You want to have no or very little scarring. You want to have minimal downtime and long-lasting results. And in my opinion, to get that combination, if you do it from the inside out approach, you're going to have essentially no scars that are visible. You're going to have a relatively quick recovery. You're going to have a long-lasting result because I free all the attachment areas and recontour before it's reset. And so I think that the best result, the longest lasting, most natural, is an inside out approach using an endoscope and using areas to access the face that are not visible after you recover from surgery.